while the numbers of people living with HIV/AIDS have dropped dramatically, about 630,000 people died from AIDS-related illnesses in 2022, according to UNAIDS. Ambassador Dr. John Nkengasong, U.S. Global AIDS Coordinator and Senior Bureau Official for Global Health Security and Diplomacy, was in South Africa recently, where he announced a global youth campaign to raise awareness about the disease. UN data reveals that AIDS remains one of the leading causes of death in the country. Reporter Vicky Stark spoke to Dr. Nkengasong in Cape Town, South Africa.
PEPFAR is important for Africa because it has been a platform that has transformed the response to HIV/AIDS since 20 years. And it has saved lives, about 25 million lives, prevented 5.5 million children from HIV infection, has strengthened healthcare systems across so many African countries. As we all know, 1 in 5 people in the world living with HIV/AIDS lives in South Africa. There are about 2 million people out there in South Africa that we still need to find and bring in under treatment. If we have to reach our target of bringing HIV/AIDS to an end as a public health threat by 2030, South Africa is important. We, PEPFAR, will be launching tomorrow a youth initiative, which is really aimed at re-energizing the youths, which will tell the youths that HIV/AIDS is a threat. It's not over. You may not have seen the devastation that HIV/AIDS caused, but HIV/AIDS is still around, and be aware of the risks. And it's really an awareness campaign, and I'm really hoping that it will become a platform that will catalyze and energize young people across the entire continent. Several activities are being done in controlling or preventing HIV infections among adolescent girls and young women and young people as a whole. And PEPFAR has invested over $800 million in empowering young women, young girls, adolescent girls, young women, so that they can engage in some sort of economic activities in their communities that will at least provide them with livelihood that they can prevent HIV infection. There are a couple of things we must do. We must close the gaps in children. The rates, the ability and capability of finding children, bringing them to care and maintaining them in care so that this viral load suppression is not great. We have to look at adolescent girls and young women and young people, because we also see the challenges we have in maintaining men in treatment and even finding men, young men, and putting them in treatment. We have to look at key populations like those in prisons, sex workers, LGBTQI, and make sure that all those policy barriers that relate to stigmatization, discrimination, criminalization are broken down. If we build barriers in that community or that subset of the population, we will never be able to win the fight against HIV/AIDS. So I think those are things that we must do. Know your HIV gaps and close your HIV gaps in all countries that are affected.